Hello everyone, I am Dr. Ankit Parakh and I work as a consultant in pediatric pulmonology, allergy and sleep medicine at Children's Chest Clinic, New Delhi. In this educational video, we'll talk about pneumonias in children. Pneumonia is an infection of the lung. Now, our lungs are made up of small sacs which are called as alveolus. And these alveoli usually are filled with air. In children with pneumonia, they get filled with water or they're filled with fluid or pus. What are the common causes of pneumonias in children? Well, pneumonias in children could be caused by viruses such as rhinovirus, respiratory syncytial virus or RSV, influenza, metapneumonia and parainfluenza viruses. Pneumonias can also be caused by bacteria such as streptococcus pneumonia or pneumococcus, hemophilus influenzae, or sometimes with staphylococcus aureus. Pneumonias can also be caused by atypical bacteria such as mycoplasma pneumoniae. What are the usual symptoms of pneumonias in children? So children with pneumonias can have fever. This fever can be sometimes low, but usually it is high. It can be associated with chills or shaking rigors. Children can have cough. They can have difficulty in breathing. The breathing tends to get fast. They can have indrawings in the chest in this area. They get low in appetite. They can be sick looking, tired, and not eating well. Occasionally, children with pneumonias can have whistling sounds in their chest which can be heard by parents. Now, some children, when they tend to get sick, they become more bluish in their color, and sometimes they tend to get sick. When do children with pneumonia require to be admitted? Well, most children with pneumonias can be managed on an OPD basis, but there are some situations when children with pneumonia tend to get sick and requires to be in the hospital. This condition could be a very sick child when the child is not eating well and gets dehydrated. There could be situations when the children have a lot of fast breathing, difficulty in breathing, and it is difficult to manage them on the OPD because they may not be maintaining their oxygen levels. And there can be situations when they become slightly more bluish or having cyanosis. And these are the conditions when children might need to be admitted in the hospital, either in the ward or in the ICU. So how do we diagnose a pneumonia in a child? Well, the diagnosis of pneumonia in children is based on the clinical findings, whether the child is having fever, difficulty in breathing, cough, and so on. It is also depend on the examination which we do with the stethoscope and hear to the lung sounds. And in addition, we would require an X-ray of the chest to make a diagnosis. What is the treatment of pneumonias in children? Well, children require supportive treatment in the form of more fluids to maintain their hydration, which can be done orally or sometimes require intravenous fluids. They might need some oxygen support, especially if their oxygen is low. Children with bacterial pneumonia requires antibiotics, and these antibiotics are usually from the penicillin group. Antibiotics in non-sick children can be given orally in the form of a syrup or a tablet, but occasionally children who requires hospital admissions will initially be given antibiotics through an IV line, and these antibiotics later can be continued at home. So if your child is having any of these symptoms which we have talked about, do get in touch with a pediatric respiratory specialist for an opinion and proper treatment.